Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I am your pharmacist, Paul White. We're glad you joined us. Before we begin, I'd like to thank our sponsor, Altman Health System. Today, Brad and I are broadcasting from our administrative offices, and our special guest is Dr. Brian Krusemark of Altman Medical Group Family Medicine of Stark County. Good morning, doctor, and welcome to the show.
Hey, well, thank you for having me, guys. I really appreciate the opportunity.
All right. We'd like to remind our listeners today that our program will also be available on our podcast. Just look for Health Matters with the Medicine Center Pharmacy in your favorite podcast app, and please subscribe to our program. Family medicine integrates the biological, clinical, and behavioral sciences for those of all ages, sexes, and for each organ system. Family medicine in Stark County family physicians are highly qualified doctors, all board certified to a nationally recognized standard for education, knowledge, experience, and skills to provide high quality care. Dr. Krusemark will be talking today about men's health.
Okay, Dr. Krusemark, please tell our listeners about yourself and your role with Altman Medical Group Family Medicine of Stark County.
Sure. Before I start, I just want to give a shout out to my wife and kids who are listening in my wife's car right now. So
Good.
Kellen, Chloe, Keegan, Ashley, I love you guys. Can't wait to see you after I get off of work today. So anyway, Dr. Brian Krusemark, I board certified physician, as you mentioned earlier, work for Altman. Graduated from medical school a little bit late. I had a bit of a non-traditional path to med school. I was in the Army for a number of years. In a non-medical.
Which unit were you in?
I was in the 1st Cavalry Division.
Oh, Cavalry. Okay.
Yeah.
How long?
I was in for approximately 4 years. I was out at,
Okay.
I got out in 2010. Yeah, 2010, 2011, sometime around there.
Okay. Did you go around the world?
Yes, I joined the Army to see the world and spent a lot of time in one place. So didn't see the.
Where was that?
No, Iraq, Baghdad.
Oh my gosh. Okay.
Yeah.
Okay.
Not a great time to be in the Army for sure. But
yes, sir. I hear you. Okay.
But thankfully got out of it live and well, and went to med school afterwards, and
wow.
Had the Army pay for a good portion of that. So
oh, cool. That's cool.
So ended up graduating in 2019 from medical school and went to residency over at Cleveland Clinic Akron General.
Oh, okay.
Had a great time over there. Moved my family to the local area because of it. We ended up liking the area. My kids have been doing really well in school, so we decided to stay.
Where are you from?
They're in the green area.
I see. Okay.
So I practice family medicine here at Family Medicine of Stark County. I see all ages. We like to say in family medicine, we see all patients from cradle to grave. See babies from newborns all the way up until I have a patient that's over 100 years old. So, I mean, we see all kinds.
Okay.
And we mainly do preventive health, but try to be as full spectrum as we can.
Yeah, very interesting. So, what is the importance of focusing on men's health?
Yeah, so men's health is often underrepresented. I think there's something about guys that have a hard time in asking for help, and particularly in the medical fields. And so, I'm just going to list some statistics that come from the Human Health or United States Department of Human Health Services. On average, men live about 5 years less than women, which is somewhat of a tragedy. And we often think that it's due to workplace accidents or injuries, but that's really not the case. They tend to be heart disease, diabetes, all the things that we think about that everybody gets tend to affect men a little bit more than women. 1 in 2 men will develop cancer in their lifetime, which is a scary thing to think about. I mean,
gosh,
there's at least one of us in the 3 of us that are on this show that are going to be affected with cancer in our lifetime.
Gosh, I didn't realize it was that high. 1 in 2.
Yeah.
Gosh.
Yeah, I mean, we have a higher death rate for almost all causes of death. I mean, like I said earlier, cancer, heart disease, diabetes, suicide. And we'll talk about that in a little bit. But, we lose about 30,000 men every year for prostate cancer, an entirely preventable and detectable disease.
Wow.
And one of the, from my standpoint, we see, and I see this in my practice too, that men make about half as many physician visits for prevention as women. And I tend to see more men than women, just because men tend to want to see men. And I still see females at a higher rate for, preventative visits than men. They tend to come in for problems. But, all of these things are detectable. They're preventable. They're easily detected by any medical provider. And it's a tragedy that we don't, figure this out earlier. It's a silent health crisis in America. It's a fact that on average, American men live sicker and die younger than American women.
Wow.
This is not the case in other developed countries. So there's something unique about how we are doing things in the United States when it comes to this.
Wow. What is the leading cause of death in males?
Yeah, so heart disease.
Really?
It's really the leading cause of death in everybody, but, particularly males, because we're at higher risk for these things. The average age of a heart attack is 65 years old. So, we think about people that have heart attacks that are older. I don't know about you guys, but I plan on living a lot older than 65. So it's somewhat scary that that's the average. And, obviously you go to a standard deviation on either side of that, and you see people having heart attacks in their early 50s, even in their late 40s.
Wow.
So, obviously it becomes very important to think about the risk factors very early on, to include getting your blood pressure checked, looking at your cholesterol levels. Yes, Ashley, my wife, I know she's listening to this. And smoking. Smoking's a huge one. Obviously, the times have changed. A lot less people are smoking today than they used to be. I think
I don't know, Doc. I don't know, Doctor. I pick up more cigarette butts on a parking lot now than I ever have.
Yeah, so I think it's got to be a generational thing. When I was in school, smoking was seen as somewhat cool. I think that's changed. Obviously, with vaping, that's sort of changing the game a little bit. And I know we're not going into the discussion of cigarettes versus vaping, but I won't even touch on that really, because that's a controversial topic. But we are seeing less. We're seeing less cigarette use, at least.
Wow. Okay. Well, that's good.
You got other risk factors include diabetes, obesity, which is another epidemic in this country, of course. Unhealthy diet, physical inactivity. Those all contribute to cardiovascular disease.
Wow.
So what can we do to prevent that?
Yeah. So first off, seeing your doctor. Okay. Meeting up with us once a year. And even if you have nothing going on, even if you think, things are great, I look great, I feel great, I think I'm doing well, just come in once a year. It's not going to hurt you. Your insurance, if you have insurance, by law they have to cover one annual physical per year, and that's copay free, so you don't even have to pay a copay. You come in, and oftentimes most of the exam is, in my mind, is done within 30 seconds of me walking in the room, because I can see you, I can smell, I can, see anything that's abnormal right away. Especially if you have a primary care doctor that you've been seeing for years, I can detect changes. Because I'm seeing you over time, you may not notice those differences because you're looking in the mirror every day, but I notice them right away. And through physical exam and through routine labs, which once again are paid for by insurance, I can detect things that you may not have symptoms of. So I can detect high cholesterol, diabetes, lymphomas and leukemias we catch through routine lab work. All of these, once again, are either preventable, or if we catch them early, we can treat them early so that they don't have an effect on your lifestyle or your lifespan.
Well, why don't we talk about common types of cancer men are susceptible to?
Yeah, sure. So, when I think of males and cancer, the first thing that comes to my mind is prostate cancer. Prostate cancer is very common. The good thing about prostate cancer is it's very slow to progress. So, it's one of those cancers that is entirely very easy to detect and very easy to treat if you're getting these preventive visits. So it's a common myth that with prostate cancer, you will have symptoms. We know that the prostate surrounds the urethra, so it can cause you to have some urinary hesitancy and difficulty urinating. Now, that's a very common problem with men as they age. And there's something called BPH, benign prostatic hypertrophy. And that just means that the prostate is getting larger, but it's benign. It's not a cancerous problem. And there's good medications that we can take for that. But any symptoms of that, and you really should be checked for cancer, because we need to rule that out. But in recent times, it used to be every time you went to the doctor for your yearly visit, you had to have a prostate exam. And I think, part of the issue with males not wanting to go to their yearly exams is the dreaded prostate exam. Nobody likes that. And, there's been a blood test come out called a PSA, otherwise known as prostate-specific antigen, that is given off by the prostate as your prostate gets larger. And so if you have a low PSA, the chances are virtually zero that you have prostate cancer. And so we can order this blood test yearly, and as long as it stays low, there is no real need for a prostate exam. And I think that alone, as that becomes more and more popular in the community, will decrease the hesitancy for males to visit their doctor. I do not do prostate exams unless that PSA is high, and I tell patients that up front.
What's a high prostate number?
Yeah, so anything above 4, we start to worry about, but that's in nanograms per deciliter. But the trend is also concerning. So if you come in one year and it's 0.5, and you come in the next year and you're at 3, well, that's a huge progression in 1 year. And the obvious thought there is that if we wait another year, you might be at 7, and so you may have the beginning of prostate cancer. So that's when we start to look. Of course, we do the prostate exam, and anything that feels abnormal whatsoever, we refer out to urology to have that risk-benefit discussion about a biopsy. And biopsies are how we detect cancers in general, because we can take a piece of that tissue and we can look at it under a microscope and tell whether these are normal cells or not. That's obviously a fairly invasive thing, but prostate, you can remove the prostate. We don't really need it. It helps lubricate things. But as we age, there is no need for a prostate, so it can be removed and you can get rid of a cancer prior to it spreading.
Wow.
Yeah, this is one of those cancers that happens at a much greater percentage in Black men than in those of other races. So, it's also something to look out there. And also, when Black men do get prostate cancer, it's generally at a younger age. So I encourage everybody, of course, but especially Black men, to get tested, at the age of 45.
Okay, it's time for our first break. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. Friends, just a reminder to stop by the pharmacy and talk to a pharmacist about our Health Matters membership savings program. We want to help you stay well and save money. So, Doctor, why is addressing mental health in this country an unmet need for males?
Yeah, so really quick, before we get into that, I did want to mention another type of cancer that affects males and has been in the news a lot lately is colorectal cancer. So, there's been a couple famous, for better or worse, there's been a couple famous people that have been affected by this and drastically increased, the incidence of this on the news for good reason. Colorectal cancer screening is something that's become very common in this country, and there's a lot of research being done to figure out why. There is a huge genetic basis in this, but there's also a dietary basis in terms of the typical American diet that can increase the incidence of this. But everybody should start their screening at the age of 45, and this is regardless of risk factors. This is at low risk people. There are 3 ways to do that. Obviously, the dreaded colonoscopy is still the gold standard. We catch 99.9% of cancers with a colonoscopy. And the good thing is if there's a polyp, it can be removed right then and there during the colonoscopy. There are, however, non-invasive tests out there. The latest and greatest is called Cologuard. It's a test where a box is sent to the patient's home, and they have a bowel movement essentially into this container, and it gets shipped back to the company. And they do a DNA profile looking for abnormal DNA of the stool. And the stool picks this up as it goes by polyps in the stool, and it sheds DNA. And we catch a good portion, well over 90% of cancers this way. The only negative is there are false positives, excuse me. If there is if there's any blood in the stool, it will be positive, and then you need a colonoscopy. But once again, this is a very preventable cancer. And if we catch colon cancer early, we can get rid of it. We can cut off those abnormal cells and live a totally normal life. if you don't do this prevention and you get cancer, it can spread to other organs and be a very painful way to live out the rest of your years. So didn't mean to cut you off there, but
Oh, that's right.
I know we were talking about the mental health for males. So yeah, so and these statistics come from, once again, the Health and Human Services. But in 2018, because obviously statistics are a few years behind, men died by suicide 3.5 times more often than women. Much more common. I mean, this is a tragedy, obviously. I mean, we've come a long way in terms of, allowing, us as males, allowing us to reach out for help and the whole toxic masculinity role of, it makes sense for us to be able to talk to each other and to be able to identify these signs and not feel like our masculinity is decreased because of this. And, there are a lot of stressors that aren't really unique to male, but, or to being a male, but that can cause this. There's the traditional male roles, obviously, such as unemployment, divorce, the need to take care of your family, need to be that care provider, source of income. Those sit in the back of our minds all the time. The estimate is that there's about 6 million men in this country that have clinical depression every year, many of which are undiagnosed. And so, we need to keep an eye out, our friends and family, for things like any kind of misuse of drugs, any sort of documented prior mental health disorders, previous history of bipolar disorder, any access to lethal means, are there guns in the house? These are things we need to constantly think about. You're at higher risk if you know somebody, if you're close to somebody who has died by suicide. And the biggest thing is social isolation. Oftentimes people that end up getting down into those depths of despair don't feel like they have friends and family to reach out to. So, obviously, if you have somebody that you know and love and haven't heard from in a little while, it's time to reach out. It's time to contact them, talk to them, and just be there for them. Chronic disease and disability are of course a huge risk factor. The fact that you have a chronic disease and you're not living the life that you wanted, that can be very depressing. And then, of course, lack of access to behavioral health care, particularly in the rural areas. And I think telehealth's done a lot to help with that, but it's still not enough.
So, in looking at an individual, a man, a woman, I guess, what are some of the more signs to reach out for help?
Yeah. So, sure. So first off, anybody asks for help, even if it's not, you're rarely going to have somebody that comes to you, whether it's a family friend or, as a doctor, and they're going to say, "Hey, I'm suicidal. I need help." Those words are rarely going to come out of somebody's mouth. So, it has to be any sort of mental health change. It's somebody, you have a friend that calls you weekly and all of a sudden you haven't heard from them in a couple of weeks. If you have somebody in your life that's become withdrawn, those are huge signs. The adolescents, constantly thinking about that. They have much higher rate of this. Monitoring social media is important. Figuring out, what's going on between their friends, what kind of relationships are they having? Has there been a recent breakup? Those types of things, just constantly being on watch.
I did know an individual who fairly recently committed suicide, and I just thought, I knew a little bit about him, and I thought, why would you do that? You had 2 wonderful children. So
yeah. And I think that it's tough because it's hard to look at somebody else and say, you know what, they have all these good things going for them. Why would they do this? It's easy. Whatever problems they're having are not insurmountable. But we also don't know what level of baseline depression they have. And what's insurmountable to one person is easily fixed by another. And so it's difficult to get into others' minds, figure that out. I personally I've had at least one friend die by suicide. And it's I to this day, I mean, I still wonder if I could have done something and nuts,
sure.
but
Exactly. So what is a preventative health visit?
Yeah, so preventative health visits. So that's, obviously a big proponent of that. That's a big part of what I do. And, like I said earlier, it's really just a chance for you and your doctor to have that conversation, all those questions that come up during the year to bring them up. And, even if you don't think it's a problem, bring it up. And I may say, you know what? Yeah, that's normal. That's not an issue. But you have no way of knowing until you bring that up. So it's a way for me to detect health concerns early, even before symptoms are noticeable. Like I said, we can find leukemias, we can find lymphomas, we can figure out whether or not you are at risk for certain types of cancers and complete those screenings. Check your blood pressure. We can detect risks for cardiovascular disease so that we can reduce your risk of having a heart attack or a stroke. We can look at your immunizations. We can talk about vaccines. Do a physical exam. We can look at the skin, make sure that there's no suspicious lesions that we need to remove. Make sure you don't have a skin cancer, which, by the way, I didn't discuss earlier, but is extremely common nowadays. And once again, these are covered, right? I mean, these are 100% covered. There isn't even a copay for them. And if we do this yearly, we can drastically decrease the odds of you getting one of these preventable diseases, or if you have a preventable disease, for it from progressing.
Interesting. Well, guess what? It is the bottom of the hour and time for the news, Doctor. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy. Okay, welcome back to Health Matters with the Medicine Center Pharmacy. I am your host and pharmacist, Paul White. This morning we are talking to Dr. Brian Krusemark.
All right, Doctor, we were talking about preventative health visits and how important they are. Anything else you want to add about why men should schedule a preventative health visit?
Yeah, I mean, not really. I mean, I just think it's really important that, we understand as a society that much of the diseases that we suffer, particularly as males, these are entirely preventable. These are, there's nothing wrong with asking for help. There's nothing wrong with asking a professional to take a look at you and saying, hey, what's wrong? I have an air conditioner at home and I know nothing about it. So I hire a professional that knows a lot about it to come and look at it every year. And it's the same thing with our bodies, right? And this is our career. This is what we've studied to do. And what's the harm in it? Is sort of how I look at it. Not only do we want to live longer, but we want to feel better while we're alive, and we can help you do that.
I think that kind of goes along with, we all think we're invincible until we're not. So.
Right. Yeah. And oftentimes, unfortunately, when bad things happen, it's too late. So.
All right. So how about we talk about diabetes? What are some reasons men are more susceptible to diabetes?
Yeah. So, when talking about diabetes, you really need to differentiate between the two types. And there's type 1 diabetes, which used to be called juvenile diabetes or juvenile onset diabetes. And we don't say that anymore because there are a good portion of individuals that develop type 1 diabetes later on in life. But that's an autoimmune disorder. So when we think of that, we think of, kids that aren't gaining weight, that are urinating a lot. That's a small percentage of people with diabetes. And so generally when we're talking about men's health, we're talking about type 2 diabetes. And that is, once again, used to be called adult onset diabetes. And there are a few reasons why men get it. Actually, the CDC estimates that approximately 15% of males over the age of 50 have or are living with a diagnosis of diabetes. And what that means is that you have a higher than normal blood sugar. And that often happens because of excessive weight. That's one of the biggest risk factors. And even if you're not a heavy person, if you eat a diet that's high in sugar, and so, how relating that to men's health, men tend to see the doctor less. We already talked about that, half as many preventive visits as females. So these things aren't detected. So, one of the things that we screen for every single year is your fasting blood sugar. And we can detect levels that are a little bit higher than normal, but not quite at diabetic levels. So we call that prediabetes. And if somebody has prediabetes, we can intervene, with counseling. We can talk to patients about, healthier diets, healthier lifestyles, physical activity. And then there are also medications that we can put somebody on that can help reduce that blood sugar and reduce the risk of progressing from pre-diabetes to diabetes. That's not done as often as I would like, but it's there. You know, and you know, if you're not going to your doctor and getting your levels checked, some things to look out for to sense that, you know, maybe there is a problem here. So anytime you start noticing that you're more thirsty or you're more hungry, those are signs of blood sugar that is a little bit too elevated. So basically the blood sugar is not entering your cells. So your body feels like it's hungry, even though your sugar levels are high. If you're passing more urine, if you have a high blood sugar, your body is trying to get rid of the sugar any way it can. So, you know, we call it polyuria. So you're just peeing a lot more than normal, particularly at night. Okay. If you're more tired, you know, that's a very common medical problem that people come to me about is, you know, doc, I'm just a little bit more tired. You know, what's going on? First thing I think of is let's check your blood sugar. Let's see where we're at. Changes in vision. You have blurry vision, you know, that can be a sign of high blood sugar. And then, you know, with type 2 diabetes, sores or cuts that do not heal very quickly. That can be a sign. In fact, so much so that before you have surgery, your surgeon will contact us and say, hey, is this person's diabetes under control? Because if it's not, we're not doing surgery, because that risk of not healing is so high. So, you know, we can talk about complications too. So, I mean, if you have diabetes that goes unchecked, you know, there are a lot of complications, but three big ones that people get that they have lifelong problems from. One is diabetic retinopathy. So your vision losses, those are permanent. There are new methods out there of treating this with lasers and such, but it's still permanent, right? There's neuropathy. So diabetic neuropathy is a huge public health problem. It's been described to me by people who have it as it feels like they're walking on rocks barefoot. It burns, it hurts. It's a sharp type of pain, and it's very difficult for us to treat. There are some medications that we can give that can kind of dull that pain a little bit, but it's permanent damage to the peripheral nerves that causes that. And then there's nephropathy, so kidney damage. You know, that can, you know, put people on dialysis. In fact, one of the leading cause of new onset kidney disease in adults is diabetes. Leading cause of adult onset blindness is diabetes. Leading cause of amputation past the age of 45, diabetes. So, I mean, we're talking about a huge public health crisis in this country.
Wow. Okay, so what are the U.S. Department of Health and Human Services guidelines on physical activity for adults?
Yeah. So this isn't really a male health question. This is you know, it's in there just in general, because males actually tend to exercise a little bit less. But you know, at least 150 minutes per week of moderate intensity aerobic activity is the official guideline. Now, when we say, you know, I have a lot of patients that come to me and say, you know, I don't have the time, or you know, my knees hurt, or my arms hurt, or my legs hurt, or some other reason why they can't do moderate intensity activity. And I think there's a misnomer about what that actually means. And so I tend to not tell my patients that they need to exercise more. I replace the word exercise with movement. Any kind of movement is good. You know, the definition of moderate intensity is where you can maintain a conversation, but your heart rate goes up a little bit. And so, you know, for most adults, that's a walk. You know, I mean, that is a walk around your neighborhood for 30 minutes. That is considered moderate intensity, and that's all I need, you know. And for patients that live in undesirable neighborhoods or that have a hard time getting outside, just walk around your house or move your legs while you're sitting or anything. Just any form of movement is better than nothing. I think there's a huge mental block, and I fall into this myself, in which I say, you know, I used to run a lot, right? Well, I can't run as much anymore, so I'm just not going to do anything. And it's sort of an all or nothing approach, and that doesn't make sense. You know, as we age, we don't necessarily need to be running 5 miles a day. You know, we just need to do something. And I think that mental block in our heads prevents us from getting to where we need to be. You know, in terms of our youth, our adolescents. The more we can get them outside playing, the better. And as a father to 3 young children, I for one know the struggle between getting the kids off the TV and off of the video games and getting them outside playing, and that is also starting to turn into a public health crisis. Childhood obesity, and so just getting kids outside playing and running around and getting off the screen is important.
Interesting. Okay, I usually walk around the stores every day, approximately 3 to 4 miles, because I got a chart that adds it up. Okay, but
I know that
but
when I was a child, I know nobody frequents malls anymore. That's not a huge thing anymore. But when I was a kid, we would go to the mall a lot, and I would see elderly individuals just doing laps and laps and laps around the mall, and it seemed odd and a funny thing to me as a child, but it makes sense. It makes sense now. And get out, go to your mall, walk in the winter. Why not?
Yeah. Yeah. So I always heard that you had to get good exercise. You got to be gone, man. Running, not running, but walkie, and not stopping. Okay.
Yeah.
But here I am. I'm walking. Some days I'll walk 5 miles
That's a lot.
around all the stores, but it's stop and go. Okay. It's not, racing or constant moving. So,
but it counts, and you should give yourself credit for that. I mean, there's a large portion of older individuals that they just the idea of getting outside and doing something is really, it's difficult for them to do that. And so
I should give myself a pat in the back, huh?
Yeah, I'm giving you a virtual pat on the back right now.
Oh my gosh. Okay. All right. Gosh. So, all right. So, what questions should older adults ask their primary care provider about physical activity? I guess we kind of covered that, but is there a basic thing you tell your patients?
Yeah, I mean, it's the how, right? Like how am I supposed to do this? And what is a safe way for me to exercise? There are obviously unsafe things. We don't want anybody that has balance problems to go running on a treadmill, right? I mean, these are some obvious things, but like I said earlier, I mean, there is this thought block in our head that thinks about our lives 30 years ago and says, this is what I used to be able to do. Now I can't do that, so I might as well not try. Well, that's just not true. Just hey, doc, you know what? Give me an idea of what I can do to exercise, and think about it in a realistic way. For some that may be just walking up and down the hallway. Because we don't want them to go upstairs, and we don't want them to go, be outside, and we want them to be safe. Maybe it's sitting on the couch and doing some leg lifts, meaning just literally just lifting our leg up off the couch, because walking is somewhat unsafe for them without a cane or without a walker. And so those are some questions to ask. For younger adults that have chronic medical problems, what's safe for their heart? We don't want anybody with coronary artery disease to be trying to run marathons. And as long as you're getting those screenings, we should be able to tell you, hey, this is safe or unsafe.
One of the first questions my doctor asks me when I go in, when did you fall last? or did you fall
sure,
recently, or what I mean? So I guess because of my age, that's probably a very common question in a physical exam. So
yeah, it's very common. I mean, first off, having falls can be a sign of something wrong in your brain. The cerebellum, which is in the posterior part of our brain, the back of our heads, is responsible for your balance. And if you have narrowing of the arteries that go to your brain, that can eventually cause a stroke. And so, having balance problems is an early sign of that. So, I mean, that's a very important thing to bring up to your doctor. Now, there are very benign causes of dizziness and vertigo and lightheadedness and balance problems, but we can tease those out pretty easily. But falls for an elderly person can be catastrophic. In fact, fractured hips are very common with falls, and if an elderly person fractures a hip, the mortality rates are extremely high. I don't have the statistics here, but it's high. A surgery to replace a hip is is a major surgery, and the recovery from that
Well, particularly if you're not in good
can never
physical,
happen.
yeah.
You know,
If you're not in good physical condition, that's a toughie.
exactly.
You know, to come back from.
Yeah.
But there's so many hip replacements being done out there, and you know, and knees. Okay.
Oh yeah.
Yeah. And I talked to a lady the other day, just had her knee done 6 weeks ago. She says, "Oh, I'm in great shape." So, but she's okay. I don't know how you're doing it, but you did it. So anyway.
And that can happen, but I think it's important to remember these are not benign surgeries. I mean, these are major surgeries, and the complication rates are they're not nothing. I mean, the complications from these surgeries can be very severe.
Yeah.
You know, I've seen cases in which people have lost their limbs due to these surgeries, and so you know, it's not something to think about lightly when you're going in for these. But certainly, if you're having significant amount of pain, yeah, tell your doctor. I mean, that's you know, the recovery from hips tend to be a lot easier than recovery from knees, but still, you know, fairly hard as you get older.
Our final break is here, Doctor. Very interesting program today. You're listening to Health Matters with the Medicine Center Pharmacy. Hey, welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White, pharmacist Brad White, and I thank you for joining us. So let's get back to the final segment of the show.
Well, doctor, I think we should talk about I think we ought to talk about testosterone in men. And, you know, we talk about health and wellness and preserving our vitality. We've talked about some cancer. We talked about regular checkups. Let's talk about feeling good and having good quality of life.
Yeah, I agree with you there. So yeah, so the fancy term for this is male hypogonadism, and you know, testosterone is a very important hormone for males because it affects how we feel. And you know, men with low testosterone are not necessarily going to have a shorter life, but they're certainly not going to have as fulfilling a life. And you know, talking about Men's Health Month, I think there's probably no bigger issue that affects males only rather than, you know, hypogonadism. So you know, we can talk about some we don't screen for testosterone because it is not super common, but it's common enough that it's a problem. So normally how this is found is you go to your doctor and say, hey, I'm tired. You know, I'm more tired than normal. And that's probably by far the most common symptom that people come to me about. But I do ask, you know, our preventative health visits, I ask patients several things to try to tease out whether we need to look at their testosterone or not. And so, you know, low libido can be a major cause. Testosterone is an important hormone for males who want to have sexual intercourse. There are other causes, of course, of this, you know, medications, relationship struggles, stress, anxiety, illness. Those can all cause low libido. But if you have a low sex drive, I mean, that's something that we need to look at. You know, study after study indicates that it is probably the most indicative of testosterone deficiency is a low sex drive in males. You know, if you are one that works out and you're just not seeing any gains, or you're gaining weight and your body fat is increasing, that's another reason to reach out to your doctor and take a look. You know, erectile dysfunction, you know, there are lots of causes. I mean, diabetes is by far the most common cause of erectile dysfunction. Elevated blood pressure is as well, but testosterone deficiency can cause that. If you're moody and irritable, there is a pretty big link between fatigue, depression, mental fog, low libido, loss of energy. All these things can just make you angry, make you cranky. And so we check those levels then. Memory, concentration, weight gain. You know, a big one that we catch in earlier, you know, in younger males for testosterone deficiency is the dreaded man boobs. You know, if you don't have a high body fat, but you tend to have a lot of tissue in your chest, that's a sign that a lot of the testosterone in your body is being converted over to estrogen. So we need to look into that. If you're losing hair, if you have, you know, male pattern baldness at a very young age, that's another sign. You know, if you're having hot flashes, if you struggle with sleep. So, you know, these are all obviously cause a lot of problems for males, and very important that we think about some testosterone replacement therapy. So I know you guys as pharmacists do compounded medications, and I know, Brad, we were talking about this a little bit earlier. You know, if I detect a low testosterone level, I discuss the risks and benefits of testosterone therapy, and I think it's important to cover the fact that testosterone therapy is not without risks, right? And you know, one of the things is if testosterone makes you feel better, why aren't we just putting all males on testosterone all the time, right? Well, the reason being is that excessive use of testosterone is consistently associated with cardiovascular death, right? And so that's obviously a big risk factor as we're putting stress on our heart. And if you're in my generation and you watched wrestling growing up, you know, you remember the Ultimate Warrior and Macho Man Randy Savage, and those guys died in their 40s and 50s from heart attacks. And you know, it's thought that they were excessively using testosterone and steroids, and that's why. So, you know, I think it's very important. There are a lot of, you see ads on TV for you know, these men's health clinics. Be very wary of those, and just make sure you do your research prior to going to those, because a lot of those are for-profit centers that are just doing massive testosterone therapy without actually checking your levels. So you call them up and you say, hey, I'm fatigued. And they say, hey, for $200, we'll send you testosterone monthly. That's a very risky proposition. It's much safer to ask your doctor about this. Not all primary care doctors will do testosterone replacement therapy because it's a controlled medication. I do in my clinic, but if your doctor does not do it, then ask for a referral to either an endocrinologist or a urologist, both of which do this quite often. Okay. There's several different ways of doing it. I use an injectable form of intramuscular injection, just because of the cost is very low. But as I understand, you guys do a compounded medication. If you don't mind talking about that a little bit, I'd appreciate that.
Yeah, and I agree with you 100%. You know, the goal, in my opinion, and I'm assuming you're going to agree, is to replace what's missing. You're not looking to make the next Randy Savage with testosterone levels. So, you know, you're looking to replace maybe what's missing, kind of get you back to that baseline that you had in your, you know, mid-30s or whatever. But yeah, I mean, we do quite a bit of topical for those. If you're not fond of the needle, you know, and getting those injections, topical application has been well proven. There are some commercial forms that are pretty expensive, and they're kind of limited in dosage because there's like one dose, and the only way to change your dose is to apply more. And sometimes the risk of cross-contamination with applying a dose you might need could be really dangerous, especially if you have pets or kids in the house. But you know, with topical applications, we can customize the dose based on what you, the provider, want the patient to have. We can make sure it's a small amount of cream or gel so that it's isolated in an area that's protected and covered by clothing after application. And, you know, Alt Care, among many of the insurance companies, is actually very cooperative with covering compounded prescriptions for patients in our community. Sometimes patients have as low as a copay as 10 or 12 bucks. You know, depending on the dose you get and what strength you would get, you know, even a cash prescription for a topical application could be between 50 and maybe 85 bucks a month. And if you get a 3-month supply, it could be less. So, but I agree, you need your blood levels checked. You need to talk to your primary care doctor, and you know, don't call the latest phone number or app to get healthcare for anything unless, you know, it's a common cold, and that might be one thing. But, you know, talk to your primary care. If you don't have a primary care doctor, you need to get a primary care doctor. So
thank you for the plug there.
yeah. And, you know, we are running a little close on time. You know, we probably ought to make sure we talk about, you know, at the beginning of the program, we mentioned where your practice is. Why don't you give your contact info and how people can get a hold of you that are interested in learning more about you and your practice?
Sure.
And you know, you can wrap it up with, you know, a message that you want to make sure the public hears today about men's health and basically getting your regular checkups.
Sure. Yeah. So, I mean, I work at Family Medicine in Stark County. We're a very large practice, one of the largest in Stark County. We have 12 full-time providers here.
Oh, wow.
Six board certified physicians and 6 either nurse practitioners or physician assistants. We are taking new patients. I myself am not taking new patients right now, but I have a physician assistant here, Jessica Fox, who I work very closely with, who is taking new patients, and we collaborate on them all the time. So you can always give us a call at 330-499-5600 to make a new patient appointment. And just one of the closing thoughts I have is it's never too late. It's never too late to get a new start on your health. It's never too late for men to ask for help. Depression is common, and there's something we can do about it. And no matter how bad it is, reach out to family, reach out to friends, reach out to us. We're here to help.
Wow.
So thank you guys so much for having me on. This has been fun.
Yeah, we enjoyed having a lot of good subjects we kicked around here, and a lot of questions that were answered.
Absolutely.
Patients come into our pharmacies and ask us all kinds of stuff. So
I'm sure.
it's just amazing. Not only males, it's females too. So, but anyway, so okay, we out. Okay.
Yep.
All right, doctor. Thank you very much, Dr. Brian Krusemark. If you suspect you have a medical issue, please contact your healthcare provider. Thanks to Altman Health Systems and our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you right here again Friday on News Talk 1480 WHBC. Happy 4th of July coming up. How about that? Thank you, doctor, very much.
All right. Thank you. Happy 4th of July.
Thank you very much. Have a great day.
Take care.